Hello people, welcome to my channel Physio Guide by Devya. Today I am going to teach about scoliosis. Scoliosis, it is the lateral curvature, sideway curvature of the spine which exceeds by 10 degrees from the normal. Is termed as scoliosis. There are two types, postural, which is non-structural scoliosis, structural scoliosis. This postural scoliosis means which occurs without no bony changes and no muscle weakness is seen in this. In this there is a bony defect. Now why this postural scoliosis occurs means due to any wrong postural habits like standing with stress on one leg or any psychological factors also may occur. Next one, due to impairment of reflex mechanism. Now, this postural scoliosis may change into structural scoliosis also due to any secondary changes, soft tissue changes, contractures, any stiffness in muscle ligaments. It may change into the structural scoliosis, means defect in bone, like this. Now, this structural scoliosis, it is of two grades. Grade 2, grade 3 means this is of that. In this, there is defect in bone which results in contractures of soft tissue on the concave side of the curve and reciprocal stretching on the convex side. Now, classification, it is divided into idiopathic, paralytic and congenital. Idiopathic, in this it is divided into four stages. They are infantile, juvenile, adolescence, adult. Infantile, it starts at the age of 3 years. Usually this is a spontaneous resolution of curve. If the curve progress and this needs early surgery. Next one, juvenile. It occurs in the age of 3 to 10 years. In adolescents, it occurs at the age of 10 to 20 years. In adults, it occurs at the age of 20 plus years. So, in everything, it is not corrected. Surgery must be prescribed. Next one, paralytic scoliosis. In this, it occurs in conditions like poliomyelitis, cerebral palsy, spina bifida. It is complicated by there is a great degree of muscle imbalance and growth age complications in this. And surgery becomes necessary where there is a rapid progression of the curve. If there is rapid progression of the curve, surgery need to be prescribed. Next one, congenital. This occurs by birth. From birth only this is seen. It is a milder or severe form. Milder form is treated with brace. Severe forms need surgery. Okay. Prevention plays a very important role. First one, early detection. We need to early detect plays a very important role in prevention of scoliosis. Next one, screening program of all the children between the age group of 10 to 14 years of age is necessary because there is this age is more vulnerable of getting the scoliosis. Next one, parents can play a very important role in the early detection of the scoliosis curve. So, education of the parents on observation technique is needful, is helpful. Treatment. In this curve less than 40 degrees, conservative treatment is sufficient for during children. Now, it is divided into 3 grades, grade 1, 2 and 3. Based on the severity of the scoliosis curve, it is divided into 3 types. First one, this grade 1, this is a postural scoliosis, means there is no defect in the bone, we said. No? The correction of deformity is observed by posture, reduction of the bad posture by reducing the bad posture by general relaxation technique or postural maintenance to maintain posture of free mobility exercise of the spine, whole spine, like spine extensor exercise and abdomen exercises. Next one, deep breathing exercises. Next, balance exercises, stretching of the soft tissues, means no bone involvement, no, we need to stretch the soft tissues. Next, after correction, the patient should be advised to continue these all exercises to avoid any severe damage. The patient must report regularly for screening. Next, in grade 2, this curve is associated with any compensatory curve. So, need a brace that are Milwaukee brace and Boston brace. So this prevents the deterioration, means severity, to decrease the curve and maintain correct posture. This trace immobilize, means it immobilize in a fixed position, immobilize the spine and maintain the stretching effect. In this exercise program are mobility exercise. First one, mobility exercise, it is important. In this spine remains in immobilized. Spine remains immobilized in brace. Next one, deep breathing, as we know, deep breathing exercise. And in lumbar rhadosis is associated with this curve, so correction of the anterior pelvic tilt is important. Now correction of major curves by putting a pad over the rib hump on convex side of the curve in brace. Next one, repeated stretching exercises of hip flexors and hamstring muscles. Now this whole program and the brace need to be continued for long time. As the child grows, brace need to be repeated adjustment and continue till the child attain skeletal maturity. Okay. Next one, this severe. Third one is grade 3, severe structural curve. In this, the curve means greater than 40 degrees. This need a surgical intervention. Now passive correction, we need to give passive correction. We need to do passive correction by hanging is the best method in this. Like how means suspension apparatus. With the help of suspension apparatus, two physiotherapist gives axial traction. One with grabs the pelvis. One with grabs the pelvis and gives traction downwards towards the legs, while the other grabs the chin and gives traction towards the occiput. So this is the passive correction with the help of the two. Next, at last, maintenance of the correction. The most important aspect is to educate the patient to maintain the correction or by active effect or with the help of spinal brace. The patient needs education for continuous awareness and exact methodology. So thank you for watching this video. This is the scoliosis full topic.